Hello, friends, and welcome to Weekly Witness, Texas Impact's weekly podcast designed to help mainstream Texans of faith understand the legislative process and help you engage with the Texas legislature. My name is Scott Atnip, your host and Texas Impact's Director of Public Witness, and today we're talking healthcare with Stacey Pogue, Senior Policy Analyst with Every Texan. I know many of you are saying, Scott, there's a lot going on in the world and in Texas. Why are we talking about healthcare? Well, I'll tell you why. Post-COVID, states are having to roll back some COVID-area policies, and spoiler, Texas is not doing it well. So while there are a lot of important issues in the news right now, to the more than 1 million Texans who have lost their health care during this unwinding, health care, or the lack thereof, is front of mind. Stacey will join us today to explain what unwinding is and why we're having to do it, what congregations can do locally, and the message for state and federal lawmakers. Yes, there is also a special session of the Texas legislature going on. You should check out the Texas Impact website at texasimpact.org and join our rapid response team to stay up to date on how you can engage there. As always, feel free to reach out at scott@texasimpact.org if you have questions about the program or ways that you can get involved. But for now, I hope you enjoyed this week's program with Stacey Pogue. Joining us for today's conversation is Stacey Pogue, Senior Policy Analyst with Every Texan. Stacey, it is so good to see you. Thanks for joining the program.
I am delighted to be here with you guys.
That is so kind. We are all very excited because the Texas legislature is back and they're talking vouchers and they're talking immigration, but also there's a lot going on in the healthcare realm. So I wanted to talk to you today about a phrase that some of us might or might not have heard, Medicaid unwinding. This has kind of been in the news, but maybe with everything else going on in the world, it might have been buried a little bit. So talk to us some about Medicaid unwinding. Help us understand what it means and why it's happening.
Yeah. So it's a jargony and weird term that just means we're going back to normal Medicaid operations. So during the height of the pandemic, the COVID pandemic, Congress passed a law that said Medicaid coverage should be locked in place for people during all of these pandemic disruptions. You might have to move, you might lose a job, but you shouldn't lose your Medicaid during this pandemic. And so nobody from 2020 to beginning of 2023 had lost Medicaid coverage, had been locked in. Unwinding, it just means we're going to go through the process, and every state will, of checking eligibility for everybody that's on Medicaid as we get back into the normal operation process of renewing people annually in Medicaid. So we're doing that now. We started in April, and it's a massive undertaking in Texas and every state to recheck eligibility for everyone on the program.
Yeah, it is a massive undertaking in Texas. I think we like to say everything is bigger in Texas, and sadly that includes our uninsured rates and our number of uninsured Texans. So this unwinding process is exacerbating that problem and is causing significant harm to Texas families. Talk to us about the scope of what we're talking about here in the great state of Texas.
Yep. So in Texas, when we started unwinding, we had 6 million Texans on Medicaid. These are by and large children. Children in low-income households qualify for Medicaid or CHIP, but it also includes some adults, some low-income pregnant women, low-income seniors, and low-income individuals with disabilities. But eligibility for adults is very limited. We haven't expanded Medicaid. It's mostly kids. So all of them are going through unwinding, rechecking eligibility right now. And Texas is doing it in a really rushed manner without kind of the systems we need and the staffing we need. And that means a ton of people have lost coverage. So far, 1.2 million people have been terminated from Medicaid, disenrolled from Medicaid. We don't know how many of them, if any, got other coverage. But the total number is not the biggest problem. The biggest problem in there is more than 800,000 of them so far have been terminated even though we have no idea if they're eligible or not, right? There's a way to lose Medicaid if you've missed some step in the process where the state Medicaid agency doesn't actually determine if you're eligible or ineligible. And that is happening at a very high rate in Texas. Most people that are losing coverage never had an eligibility determination. And a whole lot of those are kids who remain eligible. and they've lost their Medicaid coverage. And now when they find that out, they're going to have to reapply and try to come back in the door at some point. But the biggest harm in unwinding is how many people are losing coverage probably without losing eligibility at all, but certainly without the state knowing that they're ineligible.
Yeah, 1.2 million Texans, especially, most of them being children, is a shocking number. Talk about some of the things. If it's not eligibility, what are some of those things that might cause them to lose coverage?
Good question. So our jargoning term for it is a procedural denial, and that means you missed some step. People who want to renew in Medicaid or parents who want to keep their kids on Medicaid and CHIP have to jump through a whole bunch of hoops. And if you miss any one of them, you lose the coverage. And so the first hoop is you got to get the renewal notice. So if you have moved in the last 3 years during an international pandemic, during all sorts of job loss and upheaval, the state might not have your right mailing address, right? And might not have tried to get your right mailing address. So the first thing is a lot of folks just aren't even getting the packet, the mail that says they need to take action. They're also not getting the notice that they're dropped then, right? They don't find out till they go to the pharmacy counter or to the doctor's office. Other things are sometimes notices are sent in a language that's not your language. First, you can only choose English and Spanish. So if your language is Korean, Vietnamese, Arabic, Mandarin, then you can't get information in your language to help keep your kids covered. Another thing is we see examples of the notices that have two conflicting due dates. Families are confused about when they're even supposed to send their paperwork back. Sometimes you get the requests with a due date that has happened in the past, right? So it's like, oh, wow. There's just barrier after barrier after barrier, long waits at 211, the call center. In the internet website that's down on the weekend when that's the only time you have to renew. 211, the call center is only open during work hours, Monday through Friday, no evenings, no weekends, right? So families who are trying to keep their kids covered and jump over each of these hurdles, it's easy to see how any one thing not working out for you can mean that you lose coverage through one of these procedural denials.
Is there anything that state government could be doing to protect health coverage for Texas families?
Yes.
I assume that would be your answer.
Best way. Yes. The best way we could do it is the way that every other state's doing better than Texas. And it's through using data in our eligibility system to see if people are still eligible. So I call it data-driven renewals. The federal government calls it ex parte renewals. I'm going to give you the jargon just in case you ever hear it. But it just means that in our eligibility system, we have a ton of data on people. We know what they earn, where they live, their social security numbers. We know a lot of information about people who apply for Medicaid. We are required, every state is, under federal law, to try to use that data to see if somebody's still eligible before we mail out that packet and ask mom and dad to fax in their paycheck stubs, right? We, Texas, are doing worse than every other state, every single other state at using data to renew somebody automatically. So we don't have to send mom and dad paperwork at all. 3% of our renewals are data-driven.
Oh, wow.
It's failing 97% of the time. We've got states that are hitting 60%, 70%. Right. And it's just shocking when you see it. We always knew that rate was low, but we never before Unwinding had a way to see how we compared to other states. Texas is making families jump through more red tape more often than any other state. And there's no question that we can and should make it easier for eligible kids to get Medicaid and keep Medicaid, and that no state's putting red tape barriers in front of families the way Texas is.
Yeah. What do we do about that? That's bad.
It's bad. So I think we make a lot of noise, and Texas Impact, Every Texan, lots of advocates are trying to make noise in our communities, with the media, with legislators, and saying it is embarrassing and unacceptable that we can't use our IT systems and our computer systems to do data matches to keep eligible people in the coverage. So saying it's unacceptable is important, and probably, frankly, what we're going to have to do is get together for next legislative session for 2025 and demand that here's my pie in the sky hope. We just get up to average. We're at 3%. The national average is at 30%. We're 1/10 of the national average. Can we just get 30% of our renewals going through this data matching system? Because that takes a lot of burden off moms and dads and the eligibility workers who are way behind on processing SNAP applications and Medicaid applications because of the workload that they have. So probably it's going to take legislative action and legislative direction, and we'll have our work cut out on advocating for that and demanding that next session.
Is there anything we can do at the federal level there? Is there advocacy asks? What do we need to be doing on that end?
So there's a couple. So advocates are talking to the federal Medicaid agency, the Center for Medicare and Medicaid Services, they'll call it CMS. So the federal Medicaid agency, and saying, Texas is clearly not living up to this federal standard of using data to renew eligibility as much as is practicable. No, there's no question we're not doing as much as we could. We're doing worse than every state.
Right.
So it would be nice to have our federal partners say, this is unacceptable. You need to do better. That hasn't happened yet, right? But we're hopeful. The other thing is, in addition to making data matching never work by design in Texas, we are so far behind now on processing paperwork, processing SNAP applications. It's the same system that does food benefits for SNAP as does Medicaid and CHIP applications and benefits. Same people, same computers. They are so far behind that we have families who have SNAP now who are running out of benefits, and for months and months and months and months before their renewal paperwork can be processed. And I don't have to tell you guys, right, that you can't eat retroactively. Like, when you don't have money for food on the table and you don't have it for 3 months or 4 months because of paperwork backlogs, that harms families, right? And so we need our federal SNAP agency and our federal Medicaid agency to say that Texas is out of compliance with the federal guidelines on how quickly you have to process that paperwork, because there are just guarantees on the timelines about when eligible folks should be able to access the benefits they've applied for.
All right, Stacey, we always like to give our folks homework, and it seems like on this one especially, there are going to be a lot of people who are listening who hear that 1.2 million Texans number and recognize that there are probably people in their pews who are struggling. For sure, there are people in their local schools and communities who are struggling. So it seems to me like there are like two separate homework assignments. First is, how do we respond to needs in our local community? And then second, how do we talk to our representatives about this? So let's start with local action. What should congregations throughout Texas be doing to address this locally in their community?
Well, the first is outreach and education, right? More than half of all kids in Texas have Medicaid and CHIP, and they rely on it to get their vaccinations to go back to school, or their physicals, or their asthma inhalers, right? So that means kids with Medicaid and CHIP are on your street, they're in your church, they're sitting next to you in the pew, right? So we need to make sure we're telling everybody, watch for the letters in the mail. When you get your letter, you need to take action. If you need help with that renewal, because it's kind of complicated, there's free help available in every community, at the community health centers, at the food banks, at the community partner program, right? So I think the most important thing to start with is talking about, if you don't take action, if you have Medicaid now and you don't take action, you can lose your Medicaid. Raising awareness that period on which our coverage was guaranteed has gone away, and families need to act, and that there's help available, right? So I think that's the most important starting point that we can all do. Right. It's not even an advocacy. Yeah. It's just making sure, if you rely on Medicaid and CHIP, and half of us do, what do you need to do next?
Yeah. So that's an important word, because there are families in our congregations, in our communities that are struggling. And so that's an important word. But I do think we also need to take that next step and do the advocacy work. So our folks are talking to their representatives often if they're doing things right. What's the messaging on this? What's the ask that you want them to make when they have meetings with their either state or federal representatives?
I think the ask right now is one to keep it high level. Don't use any of the jargon I just did, but say, families in Texas are struggling. We are waiting too long for Medicaid paperwork to be processed and SNAP paperwork to be processed. And so our state leaders and our federal leaders need to make sure that the Texas SNAP and Medicaid eligibility system, that the paperwork processing system gets caught up. It needs help. We need to streamline. We need to staff. We need the computer fixes. We need all of the pieces to make sure that families who are eligible for public benefits can actually get in the door and get the services they need.
All right. That is super helpful. Any other closing thoughts or shameless plugs you want to leave with our listeners today?
I would say if you want more information on this, there's a website, Stay Covered TX, that gives you information on what you need if you have Medicaid and the steps you need to take, or if you want to refer somebody to local free in-person help with Medicaid renewals. There's connections to all the different community partners that are doing this work. And besides that, I just want to encourage all of us to continue working together long-term, even when technical Medicaid unwinding is over, next year, early next year, maybe March, May next year. The long-term work of demanding that it not be so darn hard for Texans to keep their kids covered, that work's ongoing.
Yeah, I would love for us to get up to average on so many levels related to healthcare.
Exactly.
So maybe we can make that our goal for the next 5 years. Get to average. Yeah. All right, Stacey, really appreciate the time. Really appreciate the work that you're doing every day on behalf of a better Texas. So thanks again for everything, and we'll talk to you soon.
Thanks, Scott. Thanks, Texas Impact.
I hope you enjoyed the conversation with Stacey. 1.2 million Texans is a real number, so I hope we're paying attention to this health crisis in our own communities, and I appreciate Stacey helping us understand what we can do to help. I hope the conversation inspired you to act. Texas Impact always has tools for you, so feel free to reach out if you have questions or if we can support your advocacy work. Speaking of working, I hope you're all continuing to promote Texas Impact's Public Dollars for Public Schools letter in your congregation and community. Those letters are being hand-delivered to the Capitol, so sign on and share quickly. As always, check out texasimpact.org for all the tools and consider joining one of our teams. While you're there, I hope you'll join us this month for Membership Month by joining Texas Impact to support this podcast and the work of Texas Impact year-round. So with that, I think it's time to close out this episode, so remember, the world needs Texans of faith active and engaged. So let's get to work.
Weekly Witness is hosted by Scott Atnett, engineered and produced by David Fasalo. Our executive producer is B. Moorhead. The opinions expressed on Weekly Witness are those of Texas Impact and our guests, and do not necessarily reflect the views of our sponsors. Weekly Witness is a product of Texas Impact, people of faith working for justice. Visit us online at texasimpact.org.